High cholesterol and high blood pressure are two conditions that many Americans suffer from and need to monitor closely. If left untreated, both conditions can lead to serious conditions, diseases, or even death. Controlling them will ultimately reduce the risk of stroke and heart attack.
Both high blood pressure and high cholesterol are asymptomatic conditions which can be screened for and detected early. The treatment involves changes in lifestyle, such as diet, exercise, and proper medications and monitoring. Managing these conditions can greatly improve the quality of life, the avoidance of serious disease, and longevity.
Cholesterol is a fatty molecule that is manufactured by your liver. And believe it or not, the human body needs cholesterol to properly produce hormones in both men and women. Your liver produces about 80% of the cholesterol needed, and the rest is produced through the foods we eat. Cholesterol also gives strength to our cells so they can maintain their shape, and benefits our nerve fibers. So the proper amount of cholesterol is a good thing. However, an excess of cholesterol in your system affects your body negatively. This excess cholesterol accumulates on the lining of the blood vessels and forms a sticky yellowish plaque. Atherosclerosis, or hardening of the arteries, is a condition that develops when this plaque thickens to the point that it starts to create a blockage in the arteries. There are two types of cholesterol, which many refer to as good cholesterol and bad cholesterol. The good cholesterol is called high-density lipoprotein, or HDL. This is produced by the liver and is essential for recycling and hydration of the tissues and organs, as it takes fats back to the liver. A high level of HDL is a good thing. It's an indicator of a healthy heart because it shows a lower amount of cholesterol available to attach to blood cells and form plaque. The second type of cholesterol, the bad cholesterol, is called low-density lipoprotein, or more commonly LDL. Also produced by the liver, instead of taking fats from muscles, tissues, and organs, it actually does the reverse of HDL and delivers and deposits fats to these areas. That is why having a high HDL level works to your benefit. There are several ways to reduce your LDL or bad cholesterol levels. The first and most effective way is to increase the amount you exercise. It is proven that exercising regularly, up to 30 minutes a day, 4 to 5 days a week, elevates HDL, or good cholesterol levels, and in return lowers LDL levels. Another way to reduce your LDL levels is to make dietary changes and be conscious about what you're eating. Avoid foods that list partially hydrogenated oils on their labels. This type of fat contains a lot of trans fatty acids and saturated fats that are both bad for your health. If you are choosing oil for a recipe, try to stick to monounsaturated fats like olive oil and stay away from polyunsaturated fats like safflower oil, sunflower oil, and corn oil, which lower both LDL and HDL levels. Unfortunately, high cholesterol and high blood pressure are both hereditary conditions, which are passed down from generation to generation. High blood pressure, though, is not a guaranteed condition, even if it runs heavily in your family. And conversely, it is possible to have it even if it's not in your family history. High blood pressure is considered the silent killer because nearly 1/3 of the people who have it are not aware. There are no noticeable symptoms to recognize. That's why it's imperative to have a yearly physical where it can be identified. Blood pressure is the force when the heart beats and pumps blood into the arteries. Blood pressure is measured both when the heart beats and when the heart is at rest. This is represented by two different numbers: the systolic number, which is measured while the heart is beating, and the diastolic number, which is measured while the heart is at rest. The systolic number is always the first number stated, and the diastolic is always second. Your blood pressure should normally be less than 120/80. A blood pressure that stays between 120 to 139 over 80 to 89 is considered pre-hypertension. Anything above this level is considered hypertension, which then goes into different stages. In 90 to 95% of high blood pressure cases, the cause is unknown. Stress, lack of exercise, and diet are certainly factors, but the best remedy is to follow your physician's orders to the T. Most importantly, if medication is prescribed, follow the recommended dosage until notified otherwise by your physician. Ultimately, if left untreated, high blood pressure is a major risk factor for stroke, heart attack, heart failure, and kidney failure.